My name is Mitch Bone, and I am the president of the Montana State University Billings Democrats and also a member of the Yellowstone County Democratic Central Committee. And today I am with House District 51 candidate, Dr. Ann Giuliano.
Hi, how are you doing, Mitch?
Good, how are you?
I'm doing great. So, but please call me Ann. The whole doctor thing is, we're okay without that.
No problem, no problem. So I just want everybody to know a little bit about you. So if you would just tell us a little bit about yourself.
Okay, so well, I've been in Billings for over 21 years. I've been a physician in our healthcare community here. First at hospital-based at St. V's, and then I was on my own with my own small business for quite a few years. I'm married to Jim Lucy, and we have 4 cats now and no kids.
Great. So what made you want to run for House District 51 in Billings?
So I got interested in politics before 2015. I was never really interested in politics at all, and kind of got interested and came to the realization that our lawmakers are really play an integral role and are super important to our policy for our healthcare, our policy for taxes. And before that, I never really, felt like politics had anything to do with me. And then it became real that actually our lawmakers have a huge role to play in my day-to-day life even. And that's certainly something that's kind of come to the forefront for a lot of people right now, how much your elected officials play a role in your life and how they impact your life even on a day-to-day basis. And so there's, ways to get involved, and one is to run. Other ways are supporting candidates, donating to candidates, knocking on doors for candidates. But I kind of wanted to be a more upfront role. And so that's how I got involved in deciding to run for the state legislature. With respect to 51, I got was a bit recruited into that district. So that's why I'm running in 51. And it also is a district that has tremendous needs, specifically in healthcare sector as well. And so it's a really good fit for me.
So why don't you tell us exactly where House District 51 is? Because a lot of people in Billings don't know exactly where all the House districts cut off.
So 51 is a really long, thin segment, and the eastern border is Division, and it goes all the way out to Shiloh. And it's really long. And the vast majority of it, the northern border is King Ave, and then it goes all the way down to the river. So it's on both sides of I-90. Though on the eastern side of it, it hooks up a little bit over to State Street. So it's long and thin, essentially along the highway. It has a lot of residential areas. It actually has a lot of commercial, King Ave and such like that. And it has a pretty wide mix of people who live in there. A lot of professionals who live sort of out in the Josephine Crossing area, and then more kind of working people who live along the strip on King Ave area.
That is a very diverse area for sure. And like you said, big area of Billings.
Yeah, it's got a big geography.
So you mentioned that you have been in the healthcare field, and I was just wondering if you could tell us a little bit about your experience in the healthcare field with people that needed government-assisted health and why that's so important in Montana and the country even.
Yeah, so that was being a healthcare provider, you really come up front, face to face with people who have needs. The most obvious area was when I was working in wound care, and I had a wide variety of people, a wide variety of payer mix. So everything from people who are homeless to people who have jobs and have health insurance and such like that. But there's a huge component of that is people who are Medicaid patients, Medicare patients, and people with essentially no insurance. And it's really obvious, like when you write a prescription for an antibiotic and that person can't fill it, or they have an injury on their foot and you're like, you got to stay off your foot, you can't walk. And they're like, I don't have a car, and the only way I can make it to my weekly appointments with you is to either ride my bicycle or walk. And right now I'm walking. So it's there's a lot of people who have a lot of needs. And that's when it became really like, okay, this is a huge issue, and we have a lot of people who need support. Another component of it is, I'm involved peripherally with Riverstone. I'm on a board, and that is our community healthcare system. That is where our people who have the greatest risk for not having health insurance and such. That's where a lot of those people go and get a lot of their services. So it's been there's a large need for support for people in healthcare specifically.
And how do you think that in Helena you would be able to help facilitate help to those that need it?
So, with respect to healthcare, the biggest piece in Montana is continuing the Medicaid expansion. That got passed through in the last session, which was fantastic, but they changed the funding of it. So now it's going to it has to get refunded every legislative session. So every single session, it's going to be, how do we fund this program? How much money do we put into it? Who's going to get the services, and what are the services? And so that's a huge piece of it. Mental health services is another part in Helena that we really need to work towards improving that piece of the population that we serve. So that's sort of the biggest piece. Another huge part is pharmaceutical and drug pricing, because everyone has issues with how things are priced. And there are certainly life-saving medications such as insulin that are through the roof in price. And a lot of states have put caps on that. They're like, you can, health insurance can't charge more than $25 a month or $50 a month or something along those lines, so that we could help protect people that way. We can make sure that pre-existing conditions are protected at a state level. So if things get overturned at the federal level, we have backup here at the state.
Those are all great ideas. So another thing that you are passionate about, is public education in Montana. So what ways would you like to see public education improved here, or things that you would like to see done in Montana for public education?
Yeah, public education is a tough piece. The funding for our system is complex. It is without a doubt tremendously complex. So, I'm a physician, I'm smart, I have a science background. I was like, okay, I'm going to look at how we do our funding for our school districts. There is a formula that determines, who gets what amount of money, and a lot of it is based on geographic density, how many students are in the population, special needs students, things like that. And it is so complex and so cryptic that I couldn't really figure it out. But what it really boils down to is that more urban areas, Yellowstone County, Missoula, Bozeman, areas that are more geographically dense, get less money per student than the remote rural areas. And there is definitely some economy of scale, but when you have 5,000 students versus 60,000 students, that you need more teachers, more, you have more classrooms and such, and that economy scale only goes so far. So definitely need to protect our funding for our public systems and not have it siphoned off, and then to see if there's any way to kind of redistribute it, though that's going to be a challenge.
Yes. So another thing that has been a big factor in the country, Montana, and just in campaigns in general, is the environment. So if you're elected, how would you like to, or look to improve the government, or not the government, the environment in Helena?
Yeah, so a lot of that relates back to our energy sector and how we turn on our lights. And Montana historically is very coal-based, and we do have a requirement to be at 15%, but that was set back of renewable energy towards our energy sources, and that hasn't really been addressed for the last 5 years, and it's topped out at 15%. Other states have kind of increased that as we've gone. I'm really interested in solar. I am putting a solar system on our house here in Billings, and we have another house in Arizona that we have solar, and we put that on a while ago. And the difference in the processes of putting solar onto the house is huge. So in Arizona, they allow lease programs. So we actually had nothing out of pocket. We had a lease company that they got the credit, the tax credits and such for putting solar on the roof, but they paid everything up front. We had nothing out of pocket. We have like $126 a month lease payment. And then at the end of that time, we own the solar, and it has taken energy bills from the range of $600 to $800 a month down to $30 or $25 a month plus the solar payment. So, and it was easy. It was easy to do. And here in Montana, there is no lease option, so you have to have a pretty sizable investment up front. The state does have some really good things. They have loan programs at low interest rate that you can apply for. They have okay net metering, thanks to what happened in 2019 with our PSC representatives. That was great that they stood up for that, and that we're going to have be able to put energy on and off the grid as we need it for a while before that issue is going to come up again. But things that aren't so great in Montana are there's no solar rebate. So some states will pay you up to $10,000 if you put as a rebate just up the front to help offset the cost of it. Other pay a certain amount, like $750 per kilowatt that you put on your roof type thing. In terms, there's a tax credit, but it's small. It's $500 per taxpayer up to $1,000. So with my husband and I, we'll be able to get $1,000 as a tax credit from the state. Other places credit up to, tremendous amount, $10,000 type thing, but more in the $4,000 to $5,000 range. We have, let's see, there's no low income solar program in Montana. Our carve out related to our performance payment program. So Montana has, requirement to have a certain amount of renewable energy, and absolutely none of it is required to be solar. So it's just been a real different experience here in Montana, and I think we could make it easier. It would help our power companies have a wider range of resources so that they can have more than just coal. And so, I think that we can move things a little bit easier for people to do rooftop solar and for other sources of renewable energy. And all of that will go to help fight climate change.
Exactly. We need to do that now. It's a huge crisis that's happening right in front of our eyes right now.
Yeah, without a doubt. All the hail, June is coming and the hailstorms are coming.
Yes. So to kind of end things, how can people get involved with your campaign, either with volunteering or just get to know more about you? Do you have like a website that people can go to?
So yeah, I have a website, which is annegiuliano.com, and it's my spelling is Giuliano. I have a pretty active, and there's a link there about getting involved. I have a pretty active Facebook page. I am on Twitter a little bit as well. People can give me a call. My phone number is 670-4680, and I'll get you involved that way. Right now, because we are all, for the most part, at home, the biggest thing to do, what I'm doing right now for voter outreach, is I'm calling people. And I'm really not even getting that involved. I'm not getting involved in politics when I'm calling them. I'm just doing wellness checks, because people are home. They may not have all the services they need. They may not have enough food. They may not have someone to go grocery shopping. So I'm calling and checking on people and facilitating them towards getting the services they need. And I'm texting people as well. And those are the main things until we get sort of more release from our home and can go out and knock on doors. But I could definitely use some volunteers helping calling. The other piece of politics, which everyone kind of hates, is how do we fund our campaigns?
There's a reason I didn't ask that.
So that's up to me to ask. So I will do the ask. So the biggest piece is money. It costs money to campaign. We have mail pieces, the texting programs cost. yeah, I have pamphlets when I knock on people's doors, all of social media advertising, newspaper advertising, all of that costs money. And so I'm on Act Blue. You can, go on Act Blue and donate through that. On my
Is there a
webpage.
link for your Act Blue on your website also?
Yes, there's on the website and on Facebook, there's a Act Blue link as well. And then that's another way also people can get involved, is they can do sort of fundraising events. Right, we're going to do a Zoom kind of cocktail hour where people can ask me questions and then hopefully help contribute to the campaign. So.
And what is the date of that so that people can know?
Oh, we haven't scheduled it yet.
Oh, haven't scheduled it. All right.
it'll be on it. It just came up, and but I'll have a link for it on post. It'll be on Facebook as an event as soon as that happens.
Perfect. Well, thank you so much for your time, Anne, and have a great rest of your day.
Thanks, Mitch. You take care.
You too.